Hello everyone, and welcome. Today, we're going to dive into a topic that's often overlooked but incredibly vital for our health and vitality as we age: iodine. We're calling it the invisible regulator because it truly matters more than you might think. We'll explore its profound impact, from maintaining the comfort and health of your breasts to ensuring your thyroid functions optimally. This isn't just about managing symptoms, it's about a functional medicine perspective, getting to the root causes for your long-term well-being. Many of us experience common complaints like persistent fatigue, that frustrating brain fog, or unexpected weight gain, even cold hands and feet, or breast discomfort. We often dismiss these as just part of aging. But what if they're signs of a modern epidemic hidden in plain sight? These symptoms, along with issues like breast pain, can be deeply linked to iodine deficiency, the unseen toxicity of halogens, estrogen imbalances, and even autoimmune inflammation. Did you know a significant portion of the population might be iodine deficient, or that a large percentage of women experience fibrocystic breast changes? And a staggering 90% of hypothyroidism cases are actually autoimmune, like Hashimoto's. As the quote says, "You aren't just tired. You are running on empty." Let's find out why. Most people think iodine is only for the thyroid, but our bodies are much more complex. The breasts and ovaries, for instance, are also iodine-loving tissues and actually compete with the thyroid for this crucial mineral. Consider the Japanese paradox. While Western diets, often low in iodine and high in things like bromine, are associated with higher rates of breast issues, the traditional Japanese diet, rich in iodine from seaweed, shows a significantly lower rate. Why? Because without sufficient iodine, breast tissue becomes susceptible to oxidative damage and the formation of cysts. Iodine acts like a protective shield for these vital tissues. For many women, balancing hormones is a key concern, especially as we get older. This brings us to the estrogen-iodine axis. Iodine plays a vital role in keeping our estrogen levels in harmony. First, it helps reduce the sensitivity of estrogen receptors in cells, lessening the impact of strong estrogens. Second, and perhaps even more importantly, iodine helps convert more aggressive forms of estrogen into a protective, gentler form called estriol. The wonderful result of this is a reversal of estrogen dominance, which can lead to better breast health and overall hormonal balance. It's about more comfort and cellular protection. Now, let's talk about a silent battle happening inside your body, what we call the halogen war. You might be functionally deficient in iodine even if you consume some, because other elements are getting in the way. Iodine belongs to group 17, the halogens, which also includes bromine, fluoride, and chlorine. These elements, found in things like certain breads, flame retardants, and even tap water, are structurally similar to iodine. They can bind more strongly to the receptors in your body that are meant for iodine, effectively locking the door and preventing your body from absorbing and utilizing the iodine it needs. It's like a game of musical chairs where bromine and fluoride keep taking iodine's seat, leaving your body functionally deficient. When it comes to thyroid health, we often see what we call the medical blind spot. The standard approach frequently focuses on hormone replacement, like taking T4 medication, which is akin to bailing water from a leaky boat. It treats the symptom low hormone levels but often ignores the actual leak. The reality is that an astonishing 90% of hypothyroidism cases are autoimmune, like Hashimoto's, where your immune system is attacking your thyroid. For lasting relief and true health, we must plug the leak, stop that immune attack before we simply keep bailing water. It's about addressing the root cause, not just the numbers on a lab report. Many of you may have been told your TSH levels are normal, yet you still don't feel right. That's because a normal TSH doesn't always mean normal thyroid function. There are actually 5 thyroid patterns your lab tests miss. Your thyroid pathway is complex, from the pituitary gland sending signals, to the thyroid-producing hormones, to how those hormones are transported, converted, and received by your cells. Issues like stress, inflammation, high estrogen, or high cortisol can disrupt this delicate balance at various points. We need to look deeper than just TSH to truly understand what's happening with your energy and metabolism. Let's uncover a tricky aspect of weight gain we call the metabolism trap. It's not always just about fat. Low thyroid function can lead to something called myxedematous obesity, a heart edema, where your tissues retain water due to mucopolysaccharides. This is distinct from regular fat and can make weight loss incredibly frustrating. When your thyroid is sluggish, your mitochondria, the powerhouses of your cells, don't generate enough heat. We call this thermogenesis failure. Your body also struggles to properly absorb glucose, leading to symptoms of hypoglycemia, and can contribute to insulin resistance. It's a challenging cycle, but understanding it is the first step to breaking free and feeling more energetic. Our bodies are constantly sending us external SOS signals if something isn't quite right. For brain health, iodine is critically important. It concentrates in areas like the substantia nigra, and a deficiency here can contribute to brain fog and even depression, which can significantly impact our mental clarity and overall mood. Look for physical signs too, like the Hertog's sign, a loss of the outer third of your eyebrow. Other telltale signs include a puffy face, especially around the eyes, cold hands and feet, and persistently dry skin. These aren't just cosmetic issues, they're your body's way of telling you it needs support. To truly understand your body, we need to talk about diagnosis, how to test the right way. The standard approach often relies on a random urine or blood spot test for iodine, which can be inaccurate, and just TSH for thyroid. However, a functional approach gives us a much clearer picture. For iodine, the gold standard is a 24-hour urine loading test, which actually measures how much iodine your body retains. For thyroid, we look at a full panel, including free T3, free T4, reverse T3, and key antibodies, not just TSH. And for a simple at-home screening, a patch test can give you an initial idea of your skin's absorption. This comprehensive testing empowers you to make informed decisions about your health. There's a significant difference between simply surviving and truly thriving, and that's reflected in the dosage debate: survival versus saturation. The recommended daily allowance, or RDA, for iodine is about 150 micrograms, which is primarily designed to prevent goiter, just helping you survive. For optimal health, inspired by traditional Japanese intake, we see levels of 1,000 to 3,000 micrograms, often linked to lower cancer rates. However, to achieve therapeutic saturation, meaning enough iodine to displace competing halogens like bromine and fluoride and fully saturate your tissues, doses typically range from 12.5 to 50 milligrams. It's important to note, though, that high doses can sometimes trigger detox reactions, so it's always best to start slow and under guidance. When considering iodine, selenium is your essential safety switch. This is non-negotiable. Your thyroid gland uses an enzyme called TPO, or thyroid peroxidase, to process iodine, and this process naturally creates hydrogen peroxide. If you take iodine without sufficient selenium, which helps neutralize this hydrogen peroxide, you risk oxidative damage to your thyroid. This can lead to inflammation and even trigger autoimmune flares. Think of selenium as your thyroid's bodyguard, protecting it and ensuring that iodine can do its job safely and effectively. Always pair iodine with selenium for optimal protection and peace of mind. To truly support your body's iodine needs and overall well-being, we need to focus on clearing the path through smart diet and lifestyle choices. First, let's stop the disruptors. Gluten, for example, can mimic thyroid tissue and sometimes provoke an immune attack. And as we discussed, fluoride and bromine are halogen bullies that compete with iodine. Now, let's go with the healers. Selenium is vital, and you can get a good dose from just 1 to 2 Brazil nuts a day. Incorporate natural iodine sources like wakame and nori seaweed. And don't forget probiotics. A healthy gut assists in converting thyroid hormones from T4 to active T3, giving you more energy and vitality. In summary, the path to wellness is about connecting the dots, not just treating numbers. It starts by recognizing the SOS signals your body is sending, whether it's breast discomfort, brain fog, or low energy. Then, it's crucial to test properly, with comprehensive panels, like the 24-hour urine loading test and a full thyroid panel, to get a clear picture. Next, we work to detox by displacing those disruptive halogens like bromine and fluoride. We support your body by pairing iodine with selenium for safety and efficacy. All these steps lead to root cause resolution, focusing on why you're experiencing symptoms in the first place. Remember, our goal is always to treat the person, not just the number, helping you regain your energy, clarity, and overall zest for life.